Hi friends, Dr. Peterson here for the May 2018 episode of Regions EMS Update. It's a beautiful day in the neighborhood, so we decided to check out the brand new fire station down here in Cottage Grove. Looks pretty nice if you ask me. And as we go straight from winter into summer, several things come to mind. First of all, it's trauma season. And second, we're at the end of the state legislative session for both Minnesota and Wisconsin. And we all know what that means, right? No? Come on. It means that it's time to review our spinal precautions guideline, learn about a condition called adrenal insufficiency, and chat with a state representative about EMS advocacy. I'm gonna go grab some coffee, so why don't you watch the intro sequence and stay tuned for the 3 things that you need to know. Several years ago, we started de-emphasizing the role of backboards and spinal immobilization for certain types of patients. We even made a CME video on the latest in spinal immobilization science, which you can find in the archives of our YouTube channel. We used to backboard everybody who had anything more than a hangnail. Remember the standing backboard takedown from your EMT training? What we have learned now is that these boards often cause more pain than benefit with actual spinal immobilization for a lot of patients. I think what some of you may have heard is that backboards are bad. We don't need to immobilize anyone anymore. Well, not exactly. So here's what you need to know. Spinal injuries are not common, but they are real and can be much more devastating than other bony injuries. We still need to have a high suspicion for spinal injury in many of our patients and take appropriate spinal precautions. But notice that I called it spinal precautions and not spinal restraint. You can still maintain spinal precautions without an immobilization device as long as the entire care team is aware of this. Backboards still serve a purpose for moving patients when they're not able to walk or cooperate, down a flight of stairs, from a car to an ambulance, or from the location of their injury to your stretcher. What we haven't talked about is the use of C-collars. Opinions on these fashionable accessories are varied, but for now they still serve a purpose to protect the cervical spine. Let's review our spinal immobilization guideline and talk about a few examples. If a patient is already walking when you get there, it's probably perfectly safe to have them sit down on your stretcher without a backboard. Do they need a C-collar? Well, we don't have any evidence-based guidance for you at this time, but just remember that older people, those with prior neck surgery, and those with unusual spinal curves have a higher chance for injury even if the mechanism doesn't seem that significant. If the patient hasn't ambulated yet, then you'll need to consider the mechanism of injury. Anything high energy, such as an ejection, high-speed collision, or a high fall, should prompt you to go ahead and use the backboard. There is such a higher rate of other distracting injuries that your exam may not be enough to rule out a significant spinal injury. These patients should probably always get both a board and a collar for now. Any complaint of numbness, tingling, weakness, or midline spine pain is also a high-risk feature and would justify the use of a backboard and a C-collar. These patients will almost definitely undergo spinal imaging at the hospital. And finally, any alteration in someone's mental status could limit their ability to recognize the sensory signals their body is sending them. This could be due to alcohol, drugs, trauma, or a medical condition. This is often the step in the guideline that trips us up. Any concern for intoxication by any substance, even if the patient seems coherent to you, should prompt you to use a backboard and a C-collar. Let me rephrase that. We need to be extra careful with patients who are under the influence of any substance. These are not the patients that we are trying to get away from backboards. Of course, all of this information could change next month, but for now, here is our current guideline. C-collars are still in style, and even though we're de-emphasizing the use of backboards, there's still a group of patients who we shouldn't be de-emphasizing. Since we're talking about trauma, I should also let you know that Regions Hospital has made a minor change to its trauma team activation criteria. Gunshot wounds to the extremities are no longer a mandatory criteria. Head, neck, chest, or belly, yes, but arms and legs, not necessarily. Use your judgment. This will be updated in the guidelines in the near future. Let's talk about a rare condition that's been getting some press lately called adrenal insufficiency. The Minnesota legislature is currently working on a bill that will raise awareness of this condition and formally authorize EMS providers to assist patients with the administration of emergency medications prescribed to them that you may not carry on your ambulance. This is already authorized at the EMT level and above in the Wisconsin EMS statutes. But none of that matters unless you know a little something about adrenal insufficiency. So let's dig in. Here's what you need to know. A typical person has 2 adrenal glands that sit on top of their kidneys, almost like little hats, or really bad toupees. Although they be small, do not underestimate the power of the adrenal gland. These little kidney hair pieces produce several hormones vital for life. Maybe you've heard of this one, adrenaline. Get it? Adrenal in? This is what lets you go from a deep sleep to wide awake in an instant when the tones go off in the middle of the night. But the hormone we're more interested in is called cortisol. Cortisol helps regulate your electrolytes, immune system, metabolism, and some core body functions like maintaining your blood pressure and cardiac output. Without cortisol, your body literally begins to shut down, which is why people with adrenal insufficiency can have problems. They normally take a daily dose of a steroid medication, like hydrocortisone, to replace the missing cortisol. That's fine, but anytime your body experiences any kind of stress, you need more cortisol to maintain those critical functions. This cortisol deficiency situation is called an adrenal crisis, or also known as an Addison crisis. People with adrenal insufficiency usually have an emergency injection kit with them, similar to how someone might carry an EpiPen for severe allergic reactions. You need to be aware of this in case you encounter a patient with adrenal insufficiency. The following animation is from a European organization called AdrenalNet that hopefully explains this a bit more. Check this out.
All right, so what is an Addison crisis? It's a very serious stress situation where your normal dose of stress hormone isn't enough anymore. In situations like this, your body has a huge shortage of stress hormone, and this can be life-threatening. There are 2 kinds of stress situations. First, the physical form. This can occur when you undergo surgery or you're ill. To prevent an Addison crisis, you should always discuss your stress schedule with your doctor before any operation. If you have a fever, you should take more pills, and if you're vomiting or have severe diarrhea, call your doctor right away. Secondly, the psychological stress situation. This can happen quite suddenly, like the shock you get when you have an accident, or it can build up over a longer period of time. For example, when you're moving. Preventing a crisis in this situation is a bit more difficult. The best thing to do is keep an eye out for the symptoms. If you find you're getting cold, distracted, unusually tired or dizzy, then take extra pills right away. Once you're feeling better, go back to your normal dosage. And if you have any doubts, call your doctor. If you can't prevent an Addison crisis, you will need to have an emergency injection. Watch the emergency injection animation to see how. So, you're really ill. You're vomiting, have watery diarrhea, and your body isn't absorbing the hydrocortisone tablets anymore. You need an emergency injection. This is how it works. First, prepare the injection with the Solicorta vial. The hydrocortisone comes in a 2-chamber vial, with powder in the bottom and liquid in the top half. Press the cap down hard until the cork shoots down. Mix the liquid and the powder gently. Don't make it foamy. Once the liquid is clear, it's ready. Put the thick drawing up needle onto a syringe and draw the liquid up. Replace the needle with an injection needle and you're good to go. Express a small amount of liquid out through the needle, so you're sure there is no air in it. Push the needle into the side of your thigh and inject the entire dose in one go. You'll feel better within half an hour, but you'll still be very ill, of course. So call your specialist to discuss what to do next. Finally, make sure you take your emergency injection kit with you wherever you go. And discuss it with your friends, family and GP so they all know about your condition and how they can help you.
So the key points to remember are that people with adrenal insufficiency can go into crisis quickly and from situations that may not seem that significant. Because this is a rare condition with life-threatening implications, if they happen to have their emergency injection kit, you should get on the line right away with medical control. Doesn't matter if you're ALS or BLS, EMTs and above in Minnesota and Wisconsin can do this with a physician's order. We all know that when laws are being made, there is value in contacting your legislators, but EMS folks may not always know the most effective way to do this. Sometimes we don't even know where to go to get the best information about what is going on in our state or at the national level. Then when we do know about the issue, it can be intimidating to reach out to our legislators. Today we're interviewing Representative Amy Loudenbeck of Wisconsin to help us learn how to better advocate for EMS as a profession. Thanks for joining us today, Amy. Can you tell us a little bit about yourself and how you got interested in EMS?
Sure. Well, I serve in the Wisconsin State Assembly. I was first sworn in 2011, and I come from an area that is served by both career fire and EMS and volunteer fire and EMS. And actually, back in the 90s, I served as a volunteer on my fire department, and so I do have a relationship with chiefs and members of, again, volunteer, career, and combo departments in my district, and I happen to be married to a firefighter paramedic that is on a career department as well.
Excellent. Where would you recommend that constituents or citizens get up-to-date, unbiased information on current legislation or issues that are occurring at the state level?
Well, Wisconsin, we actually have an award-winning system where all of our bills are available online. You can actually go in and see testimony that's submitted on bills. You can see the fiscal estimates and all the analysis. For us, it's legis, legis.wi.gov, and you can search by topic, by bill number. You can track bills and get information. But again, in the beginning of the session, I usually try to put in my newsletter the Citizen's Guide to the Legislative Process, direct people to some of the resources that they may want to get involved with, because as the session gets busier and there are so many bills, a lot of times the ones that just make the headlines in the media are not going to necessarily be the ones that are of interest to you and your interest group.
So for Wisconsin, that would be WEMSA, and Minnesota, there's the Minnesota Ambulance Association, Fire Chiefs Association, a number of different organizations that our providers can get involved with who have active lobby groups at the state level.
Absolutely, and they are a great resource, the associations, because the jobs of the actual boots on the ground folks are not necessarily to track and monitor legislation and weigh in on it, which makes the advocacy as a group working together, that function that you have a point person for that is incredibly important.
Okay, that's excellent information. So now a situation, what if I try to contact my legislator but I'm not able to get in touch with them, or I get, I end up speaking with an assistant or a staffer. Should I feel put off or ignored by that, or is that how the process works? Can you just explain a little bit about how the communication chain works?
Sure. Well, I can give you a couple different examples. So we get emails, for example, that are definitely kind of boilerplate, and that's fine. If people want to use a template that the association puts together, whether they like it or not, that is probably going to get a response back from me that's pretty boilerplate as well. If you call and you acknowledge that again just gets passed on to me, and it's important, and staff do pass on messages to legislators. If you called or emailed and said, I really want to talk to the representative about this issue, the staff is going to take that and get that on the schedule. But if you just are going to say, I think this is a great bill, I want you to vote for it, the staff can absolutely take that information to the legislator.
Sure. So that kind of leads into the next question. So what do you do with the information when you get all of your constituents advocating for specific issues? How do you compile it, analyze it, and decide how you're going to make your decision on supporting or developing a bill?
That's a great question, because I think it really depends on what the issue is. Let's say, for example, I get a lot of people that are concerned about a specific element of a bill, and it's not a bill that I authored, and it's not a bill that I'm on that committee. So it will give me a heads up. I need to look at this. But sometimes we get input on bills where they may have read a headline, or there may be some misunderstanding on what the bill does, which often happens.
So you mentioned testifying. I recently was asked to testify about an issue in Minnesota, and when you hear that term, you kind of think of courtrooms and cross-examination and something that sounds a little intimidating. What does that mean in a legislative context?
So for me, when I chaired a legislative committee, I wanted to make sure that people that came, especially members of the public that came and testified at the hearing, that I would treat them as if they were in my living room and they were my guest, and I would be gracious and try to make them as comfortable and at ease as possible. I can't say that every chairperson operates that way, but I think if you come in and you're prepared and you're friendly, and even if you're nervous, the members understand. They know you have traveled a long way. We actually have a rule in our assembly that we want to get at least 3 members of the public that are not lobbyists or members of agencies or other legislators to come and testify on bills, so we make sure we're getting input from the public. So we encourage that, we welcome that.
So what I'm hearing then is that it's helpful to contact your representative or senator's office to share your viewpoints or your support or disapproval of specific bills, but then another good opportunity would be to actually show up at a committee hearing to provide public comment or to testify either in favor of or against a bill. And both of those are effective ways to communicate with your representative. Is that correct?
That is correct. And from an association standpoint, a few times we've had situations, and this is normal, it's normal with any group, whether you're realtors or EMS professionals or fire chiefs or manufacturers, where the association may have a position, but that doesn't mean that every single member of the association agrees on it. So again, important for the direct contact, and if you belong to an association, make sure that you let them know how you feel as well, so that they're not taking a position that you disagree with.
Are there any other hot EMS issues that you see either currently or on the horizon that we should be aware of?
Well, one of the things, and I've learned this at one of your conferences, but I think it's meeting the expectations of the public within the framework, where if you look at even EMS response, ambulance service, where originally that was it's a Medicaid transportation benefit. It's not necessarily the promise of paramedic health care every time you pick up the phone and call 911. But if that's the public expectation, I think that is something that local units of government as well as private response companies need to get a handle on the cost of providing that care and how it fits in with the network of insurance and providers that currently exist. And I think there may need to be some changes there. I know that communities that I represent, their EMS provider costs are going up. Their fire calls are going down. We've got aging populations. We've got a lot of rural folks. And so trying to meet the needs and, as I said, expectations, because the expectations of the public are pretty high compared to what EMS historically has been able to provide within the resources available.
Well, Representative Loudenbeck, thank you for sharing your perspective with us today. I'm sure this will be helpful information for many of our EMS providers as we work to further professionalize the profession of EMS and improve the working conditions and the patient care that we're able to offer our communities.
Fantastic. Very nice speaking with you.
Well, that was some great information. If we want to advance the profession of EMS, we need to be advocates for our patients and for ourselves. Don't be afraid to get involved. Change can't happen without awareness. No updates on medication shortages this month. Pain medication might still be spotty, and ketamine is very limited, so make sure you're familiar with your other options for RSI and agitation management. And finally, just a reminder, if you haven't done so already, download the Regions EMS app from the resources page on our website, regionsems.com. We'll be posting some guideline updates soon to the app to reflect the new TTA criteria, as well as remote ischemic conditioning for STEMI patients that was discussed in the March update video. Thanks to the Cottage Grove Fire Department for being good sports this month, and to Representative Loudenbeck for taking time out of her busy schedule to chat with us. Enjoy the warmer weather, and stay smart, stay safe, and stay professional. See you next month.